really, it has been the mainstay that population-based cohort studies have really informed not only about the understanding of the disease, but also on how to manage and screen for those diseases. So I think it's very important in a country like India, where there is so much diversity in diet and so much diversity in risk factors for cancer. We really don't have any really very few studies that look at population-based cohorts which you follow through time to try and understand what are the risk factors and what influences incidence of cancer. There is really a lot of dearth in the literature about risk factors for cancer in India. We really don't know what the association of various regional dietary patterns are with cancer incidence. There is a lot of studies that talk about tobacco control, but we heard that about oral tobacco use, which is a epidemic in this country, particularly in some parts of the western part of the country and in the south. And that needs to be understood in a systematic manner. Why do people use these products? Can we prevent initiation? If it's tobacco and you can't prevent initiation, can you understand how you can bring people into cessation clinics, for instance? So those are studies that are waiting to be done, and I think that's a great opportunity. I don't have to reiterate the role of sort of these low-hanging fruit, if you will, these studies that look at HPV vaccination. How can that be adopted in communities across this country and others? And also early detection of cancer, whether it is by using community-based approaches of training women to training health workers to screen for cancer, or using some sort of technology that can be used to detect cancer early. So these are just some examples and thoughts that we had in terms of cancer research ideas. And I'd like to end with saying that when I meet professionals and doctors here at Apollo, it just strikes me that this is a great opportunity to sort of develop a very strong research program. But what is important is you need more than doctors to really conduct a research program, and I think that's very important. I'm very glad to hear the interaction that Apollo has with sort of survivors and the patient community, because if you look at diseases like HIV, which started with nothing really, they didn't have a vaccine, they still don't. They don't have a treatment, they never did, but there has been a lot of engagement at the community level, a lot of research strategies that were used to understand how do you reach communities so that they can avail of the technologies that are available at that time to address a particular problem. And I think that type of research question has not yet been asked and answered for cancer. We really need transdisciplinary teams. You need epidemiologists, you need statisticians, you need social scientists who can craft ways to engage with the community and ask those questions about why people are shy to come, what is the stigma, who are the agents in the community that you need to be involved in to address the issue of stigma. And I think those are some very interesting questions. And you do need research managers. And these need not be PhDs or doctors. They could be somebody with an MBA or a very smart person who is just out of college, who's able to manage a large research program. And these are the kind of things that people don't think about, but I think for an institution like Apollo with all the resources, developing a research team might not be that difficult. Again, the research infrastructure is important. We need people to manage the research project, staff to interface and interact with the patients, people who can collect and analyze data. And I just wanted to leave you with those thoughts as we are talking about cancer, and to say that research is indeed a very important component as we seek to help patients who live with cancer. So I'll stop there, and I'm happy to answer questions offline. Thank you.
Dr. Preetha Ramarajan, the South Asia Program Director at National Cancer Institute. Following her receipt of her doctoral degree in epidemiology from the Johns Hopkins Bloomberg School of Public Health, Dr. Preetha pursued a postdoctoral fellowship in molecular epidemiology at the Radiation Epidemiology branch at National Cancer Institute. Dr. Preetha acts as a reviewer for several international journals and is on the editorial board of Frontiers in Cancer Epidemiology and Prevention and also the South Asian Journal of Cancer.
Thank you so much for inviting us to be part of this conference today. It's been really moving to see the amount of dedication that there has been to cancer control and prevention in India and amongst so many different institutions. So what I'll be doing today is just giving you a quick overview of the kinds of things that we at the National Cancer Institute are doing in South Asia, and particularly here in India. So as Dr. Sudha had just mentioned, to put this in a little bit of context, the National Cancer Institute is the oldest and the largest of the 27 institutes of National Institute of Health. But as you can see here, even the National Cancer Institute is made up of several offices, centers, and divisions. But in 2011, as one of the 5 priority areas defined by the director of the National Cancer Institute, the US Center for Global Health was set up. And the first director appointed to the center was Dr. Ted Trimble, who we're very fortunate to have with us today. And while there are several different areas that the center covers, they can really broadly be summarized in 3 main strategic priority areas. And what I'll do is I'll come back to these later, but just the first, of course, as you've heard before, is to really strengthen cancer research around the world. Of course, this can't happen without building a really solid cancer research community. So that's where the second batch of activities occurs. And finally, to echo something that Dr. Shanta said to us this morning, research is not relevant unless it has social relevance and can be translated. So that is the third set of activities that we engage in. So coming to the New Delhi office, it was established in 2012 and broadly has a focus on the South Asia region, which includes Bangladesh, Bhutan, India, Nepal, Pakistan, and Sri Lanka as well, but we haven't really done much with Sri Lanka to date. Within this region, of course, there's a few reasons why it makes sense to particularly focus on India. First of all, we've heard again and again today, India has a large population and thus has a very high cancer burden. Over 1 million individuals every year in India are diagnosed with a new cancer. And this number, as we saw, is growing rapidly. But aside from this grim scenario, I think what's actually much more hopeful is the fact that along with this, India has the potential for world-class research. It has dedicated scientists, excellent clinical treatment centers. And so this is really a very exciting time for NCI to be here in India because we do feel that working together, we can stem some of this tide of cancer that's really been predicted by all of the statistics. In terms of the engagement between US and India, NCI has certainly had a long history of funding projects in India, but our formal engagement between our 2 governments really started in September 2014, where the Prime Minister of India, of course, Prime Minister Modi, went to the US and he met with the director of the NCI at that time, Dr. Harold Varmus, and they had an informal conversation about the importance of cancer research, including the need for vaccines that can prevent cancer. This theme was reiterated when President Obama then met Modi, and they actually went on to make this a little bit more official by issuing an official joint statement between the 2 governments, stating their intent to collaborate on cancer research as well as patient care delivery. And this conversation, of course, came back to India, carried on, and last June, a formal memorandum of understanding was signed between the 2 governments. The lead agency on the US side was the National Cancer Institute. And on the Indian side, 4 institutes that are very involved in either the treatment, research, or funding of cancer-related activities. The All India Institute of Medical Sciences, the Indian Department of Biotechnology, the Indian Council of Medical Research, as well as the Ministry of Health and Family Welfare. So within the MOU, there's a number of specific points that have really been outlined in terms of things that we will work on together. But they fall broadly into we must increase collaboration between our two countries. This should focus very much on capacity building. And we are interested in research across the spectrum, from very nuts and bolts cancer biology, as Dr. Sudha had mentioned, to cancer prevention, palliation, and so on. So now I'm going to come back to the 3 strategic priorities of the Center for Global Health that I had started with earlier in the talk. And rather than go through a laundry list of all the different activities we've done in India, maybe just give you little snapshots of the kinds of things we do. And then certainly you can grab any one of our team afterwards, and we can tell you more about either that activity or the kinds of activities related to that. So one thing that we do in terms of strengthening global cancer research is help set research priorities. And a couple of years ago, partnering with the Department of Biotechnology, what we did was to invite leading scientists looking at cancer research across the spectrum from the US and elsewhere in the world to India to meet with leading Indian scientists here and who are selected and invited by the Department of Biotechnology. And as you can see, they gathered around in a small round table and really thought about what are the unanswered questions here. What are the questions that are particularly relevant to India? What are we not funding that we should be funding? And in fact, the outcome of these 3 workshops, which we did in 3 different cities in India, were to come out with a list of questions that some of the top minds around the world had decided these are questions that should be answered. And certainly the USNCI has gone on to issue a funding announcement based on this list. And indeed, the Department of Biotechnology is also using it to help plan where they will fund research. A second priority within strengthening global cancer research is strengthening research in regional cancers that are specific to an area, that make sense in a local context. So in India, for example, gallbladder cancer, nasopharyngeal cancer in certain areas that are very common here, but not really that common in the US or the UK. And so these are the best places to study those cancers. And again, one example of this was, again, an expert workshop that we had organized on the early detection and screening of common cancers. And some of you were there at that workshop, and you will recall that it was a wonderful 3 days of really thinking about what is the evidence around the world in terms of screening of the 3 most common cancers in India: cancers of the breast, the cervix, and the oral cavity. And based on what we know about the health system in India, what really makes sense for us to recommend. And the recommendations that that group came up with has since been published in the Lancet Oncology, and we'll come back to this, but you know, we don't want to leave it there. There's a what next? What are the next steps after this? So of course, as I'd mentioned earlier, we can't strengthen global cancer research without making sure that the research itself is addressed. And certainly within India, we've had very specific requests from different organizations saying, we really realize that tobacco control is important, but we're not sure what the best methods are. And so we brought in the experts and had a couple of workshops on that. We had a couple of different centers saying, we know that there's a lot going on in molecular epidemiology and statistics for genetics, but we're really not sure what the best way to design these studies are. And so we've had 3 workshops on that. And similarly, we've had faculty and sponsored a couple of different workshops on the design and conduct of clinical cancer research. So then the second of our 3 priorities is to build a global community of cancer researchers. And certainly you can see already in the activities that I highlighted before this, some of these workshops, these brainstorming sessions, very organically actually create that community. And in fact, many people who have been involved in those initiatives have gone ahead to form collaborations with other experts that they met in those settings, and even put in grants together. But sort of addressing it more immediately, I think we've heard several times today in Dr. Maliga's presentation, and Dr. Shanta's presentation, Dr. Trimple's presentation, of the importance of communicating our work. And this actually is in a couple of different settings. So one of the things that we've done in several countries around the world, and we realized, gosh, this would really make sense to do in India as well, is to start by training journalists. Because cancer is not an easy disease to report on. It's complex scientifically. And odds ratios and p-values, what do these things mean? It's so technical. And so we've had a series of workshops here training journalists on how to report on cancer. And of course, the other people who don't really do a very good job often of communicating well is us as scientists ourselves, where we may understand our work really, really well, but we're not always very good at communicating that to the media, to other scientists, et cetera. So we've had the opposite workshops as well, where we're actually training scientists in India to communicate elsewhere. And many of you will recognize the face in this photograph, another Chennai native, Dr. Soumya Swaminathan, who's now the secretary for the Indian Council of Medical Research, and she is very, very much behind this initiative and this idea of scientific communication and training. We also support research networks and fellowships at NCI, which you've already heard about in some detail, and so I'm not going to repeat here. Finally, moving to that third bullet, what is the social relevance of what we're doing? How do we translate this research into practice? And what I'm going to do here is actually talk about some of the things that we are planning to do moving forward. As I'd mentioned, we had that 2013 meeting on what would we recommend for early detection and screening in India. But several groups after that came back and said, well, you know, we've already started something, or we really want to start something, and you kind of left us hanging there because we're not sure how to do this right. We want to make sure we're doing this in a way that we're evaluating, we're monitoring. And so we heard that, and we're following up with what we hope will be a very focused meeting either this fall or early next year, looking at, first of all, did the evidence change between 2013 and now? Would we still recommend the same things, or would we change that slightly? And secondly, you know, once we have our updated recommendations, how do you implement